Okay, anyway, okay, so basically today we'll be talking about this thing called skin pigmentation. So, do you guys know what is skin pigmentation?
I mean, I do see on my mom lah, especially when she go under the sun, you see all this brown color age spot lah. She call it age spot.
Okay, yeah. So basically, skin pigmentation is basically just darkening spots in our skin itself. So it can be called by hyperpigmentation, can be due to, we call it dark spots, can be called as darkening whatsoever. So basically, in our skin itself, there's this thing where the skin cells which is evenly distributed between all our faces, our body and all, that produces this thing called melanin. So melanocytes produces melanin. So basically, melanin will cause this darkening of skin, and this melanin's function is to basically protect us. So different people, different races, they all do have different amount of melanin. So like of course, darker skin people, they might have more melanin basically. Okay, so when we have skin pigmentation itself, it can be due to many causes. So they can be two. One is called the external causes, 外面的, and another called internal causes, which is the internal factors. So external causes basically is the most common cause, which is the sunlight, UV light itself. So when our skin is being exposed to the sunlight itself, so there's this thing which will be produced, which is melanin itself. So let's say if our hand is constantly being exposed to the sun itself, it will be damaged. So melanin will overproduce itself, causing it to be darker. Okay, so basically this will cause dark spots.
Okay.
Alright, so this is one of the most common external causes. For the internal causes, it will be more towards hormone, and it usually happen to women or older age people. So women itself, when they are, they are after menopause, after pregnancy, they give birth itself, they start to have these dark spots around our body, around their body itself, especially their hands itself. So this can be due to internal causes also. Okay, so when we talk about skin pigmentation itself, so basically there's a few types. So there will be freckles. Freckles.
I always find it very cute.
Yeah, they are quite cute actually, but actually they are actually caused by sun exposure.
Oh, I see. Okay,
and also by genetic itself. So yeah, these are freckles itself. They can be lentigines, they can be melasma, they can be dark circle, they can be many other causes lah. So so talking about freckles itself, they usually happen to younger age people, where they are actually, I would say they can be prevented from becoming too serious itself by applying sunblock.
Okay.
Yeah, so at the young age itself, you'll be actually very wise to even apply sunblock for those patients with a lot of freckles. And how about lentigines? Basically, they are a type of skin pigmentation which is due to mainly ages. Melasma, if you heard before, basically it happens usually on the face itself, especially on the cheek, especially on the forehead itself. Their causes are actually all quite related one, sunlight, and happens mainly to women also, especially menopause and hormonal changes itself. So giving you all these names itself, basically they are just skin pigmentations causing all these things itself. So of course the golden question is, what is the main prevention for this type of condition, skin pigmentation itself of course the best way is to apply sunblock. It should be done especially every day. Even let's say indoor itself, it should always be done by applying sunblock. And especially when you're driving itself also, if you notice many of our parents itself, especially if you look at our mother itself, you see their hands itself, you do see many of those dark spots. Melasma or sunburn whatsoever. Those are actually being due to sun damages, UV light itself. If you have siblings, if you have family members itself who like to go under the sun without sunblock itself home, you can actually just show them pictures of those elder people where they have dark spots around themselves. Those are basically true sun damages. So
it's mainly an image thing lah. But is there like any medical condition, like if you have all this like pigmentation, will it lead to something else or something serious?
Oh, good question. Yeah, so chronic sun exposure, especially people who work under the sun, like farmers lah, like people who work in plantation itself, yes, they do get this skin condition called melanoma, where it's due to chronic sun exposure. And these are actually cancers, but they are very benign. Usually when they happen on your face itself, on your skin itself, they can be treated. Yeah, but of course, if it happens on your face itself, it can create scars and all lah. So it also lead to maybe squamous cell carcinoma or many different type of carcinoma, which is skin cancer itself. So applying sunblock not only will help you prevent cancer and also make you look nicer lah. Yeah, because if let's say a person or lady itself having hyperpigmentation itself, you will definitely cause a bit of social stigma lah.
Self-image image also.
Correct. So yeah, so how to apply sunblock? I think we said earlier about the SPF, right? What to choose, right? Basically, all these SPF 15 and above to 30 and above is actually more than enough already. Anything higher than that, it will help for sure. Maybe they are a bit more expensive. I wouldn't say they are marketing gimmick, but generally, if there's SPF 15 to 30 above, it's more than enough already. So to apply it every single day, when you apply it, especially to those exposed areas like hands, the legs, the face, you try to leave it there for about 15 to 20 minutes for them to absorb. Sorry. Then let's say if you're a person who sweats a lot, then it will be best to reapply them every 3 to 4 hours. Yeah, so sunblock, try to cultivate the habit. Do you apply sunblock today?
Yeah,
so you see your skin, very good, 滑滑的. You touch it, it will slip.
No, 很爱美, 很爱美.
咚的. Yeah, so basically you see everybody, especially female, they will definitely apply sunblock itself lah. So it's a thing that you should cultivate the habit. So treatment wise for skin pigmentation, there isn't really much choice. Orally, there are a few products, but we will focus more towards treatment when it comes to clinic itself lah. First, you have heard of chemical peel. So chemical peel, basically they will the doctors or the nurses or the spa itself, they will apply this very powerful chemical around your face itself, which will so-called exfoliate the outer layer itself. So you will change a new layer called 焕肤. Yeah. That's basically what the function of chemical
like
peel.
Changing skin.
Yeah, correct. So you're inducing skin, so-called chemical skin damage itself, so that you produce new skin. So hopefully that will lighten your pigmentation. Second, laser. Yes, laser will be definitely the most advanced treatment now. So lasers like Q switch, like pico laser. So basically, if you Google itself, these are lasers which will target the melanin cells in your skin itself and break them down. So they will decrease the skin pigmentation. This will definitely you can't lighten it at one course itself lah. So your doctors will definitely tell you to go for every once a month for maybe 5 times, 6 times, depending how severe this skin pigmentation is lah. So this is basically the treatment for skin pigmentation. First, you prevent it by applying sunblock. Second, if it's really, really bad itself, go and consult your doctor, and they will most likely give you advice about your procedures lah, like lasers. There are also many products like, have you heard of crystal tomato, or maybe those oral high antioxidant medication or supplement itself. They do work, but not everyone. So it really depends lah.
Because I know that some skincare or over the counter, sometimes they put there, target pigmentation. But I guess it's mainly to lighten up, maybe just to lighten up, but it doesn't really target the pigmentation per se lah. It just lighten up the skin, then make it not so obvious.
Correct.
I think that's how they work lah.
Yeah, but the thing is, they do have very high antioxidant content in them, which will definitely decrease the production of melanin. So that might help. So I wouldn't say they are 100%, but whatever works lah. Yeah, if you can try them. There's no harm one. But of course, get those FDA approved one lah. Yeah. So of course the last 2 steps is basically our diet wise, which is we'll come to her, and also how we clean our face itself. I think cleaning the face itself is also very important. So when you see all those products outside, you'll be so confused of what to use. But the thing is, actually, if you break them down, it's very simple one. Okay, so first, cleanser, 洗脸霜. How to clean? So basically, 洗脸霜, there's 3 types of skin which we are all distributed lah. So one will be the oily type like me, that there will be a normal skin and there will be a dry skin. So you find whatever cleanser which helps you to clean and you feel good and keeps your face clean itself. That's first step. So that's cleanser. Second, if let's say you have very oily skin itself, right, after cleaning it at least twice a day itself, 3 times better, will be toner. So toner itself will help you will help you with your oily skin condition basically. So that's more towards toner itself. So cleanser, toner. You have no oily skin, toner, maybe don't need lah, but it's definitely a more expensive way of cleaning your face. 3, you see your mother, you see your wife, you see your girlfriend every day, that's basically, I think, more towards moisturizer, hydrating your skin for those very dry patients. So hydrating your skin, moisturizer, first in the morning itself, your UV sunblock itself can be a form of moisturizer. So in the morning itself, you might not need to use them, but at night, we call them the night cream, or all those night moisturizer stuff. They are high in vitamin C and etc. Those we use after cleansing, toner, then moisturize. Yeah.
Yes.
So that will keep your skin moisturized. Okay. Then that's it.
Can you over cleanse your skin?
Oh, you actually can, you know.
Because I felt that the skin is so oily, then I want to make sure it's clean, right? I'll cleanse and cleanse and cleanse.
So if you've watched the previous broadcast itself, over cleaning your face can be an issue also. So over cleaning your face, basically like what she said, if you clean your face one time, you feel还不够干, you clean again and again itself, right? That might cause problem. Like I said earlier on, if you over clean it, you kill off the friendly bacteria in your skin, and that cause you acne problem lah. So just find the suitable one lah. You know, cleanser, toner, moisturizer. But if you're like me, just cleanser, no problem.
Because you have good skin, right? But I do know from a friend of mine, she's a beautician. She did mention to me that sunscreen or even sunblock actually is a makeup on its own. So you actually use makeup remover to remove the sunscreen before you proceed on to cleansing. Because a lot of people actually make the mistake, they thought like, oh, I put sunblock, then it will be okay, then I'll just cleanse it off. But then actually you have to use makeup remover to remove the sunscreen first.
Correct.
Then you cleanse it, then you just proceed with whatever step you have.
Yeah.
What about mask?
Mask is basically just hydrating.
Hydrating. So if your skin is quite okay, you don't really have to use mask.
I mean no harm lah, 补水 lah. Because you see those masks, right, are basically being used usually at night, right? Before they sleep. So after they clean their face itself, after they put the toner itself, they will apply the mask itself. That's basically moisturizing. If you ask me,
you have good skin lah, so you don't really use mask.
If you ask me, I mean, if it helps lah. You know, use it only, no harm. Your skin 嘛，花点钱，不用紧的。Okay.
In terms of diet, actually, when I go and look at the internet or even those research, not many articles that actually look at diet per se lah. You know, in terms of pigmentation, because we're looking at pigmentation today. But this common ingredient keep popping up, which is tomato. Tomato apparently is very high in lycopene, and it's actually a very
guys.
Yeah, lycopene. It's actually a very powerful antioxidant for the skin, and I think that is actually the main ingredient of some of the skin products that we see. Like crystal tomato is actually a very atas or a very premium product on its own that use tomato as their ingredient. So when I look at tomato and other colorful, I would say orange or red color fruits and vegetables. These are actually
Red
very high
and
in
orange.
lycopene. So you have sweet potato, you have watermelon, because watermelon also is red color, so it's lycopene.
Okay.
You have what's that called?
Carrots.
And then you have the capsicum,
Broccoli.
red color. Okay, sorry, that's green.
Okay, fine, sorry. Yeah. Red and
Pumpkin.
orange.
Yeah, red and orange. These are some of the food that are very high in lycopene, and they usually help to promote skin health in per se lah. And they do help to reduce formation of pigments. Yeah, so usually I encourage people to eat more red or orange color
Red and orange.
fruits and vegetables. Yeah, apparently it's also good for prostate care also. Yeah, so tomato. Yeah, that's why it's lycopene is a very powerful antioxidant.
Okay.
I mean, in general also we encourage people like not every day eat red, orange, because otherwise you will have this condition where your palm or skin become orange color, right? Do you see patients that eat like papaya or this?
Very seldom.
Very seldom.
It's very rare one. Textbook cases. Yeah.
Yeah, but if that's the case, then usually I tell people, besides eating lycopene stuff, you can actually incorporate other fruits and vegetables like broccoli, a variety of fruits and vegetables because they are very high in antioxidants. Yeah, I think this is something I keep repeating for my last few sessions, like keep eating fruits and vegetables, because I really felt that our society nowadays we eat a lot of outside food, and even when they eat vegetables outside, it's usually overcooked. Yeah, overcooked. So you really lose a lot of the vitamin C and the antioxidants inside. So if you have the opportunity to prepare meal at home, or even if you eat outside food, salad actually with olive oil dressing is actually one of the healthier choice.
Salad?
Yeah, salad. Yeah,
Olive
I know it's
oil.
quite a very boring option. It's something that people usually don't go for when they are outside. But if you are someone that always eat out, once a while, including some salads in your diet will actually be good for your skin and health.
But I think it's right. Actually, I noticed even among our friends, they start to order salad already.
From where?
No, whatsoever. If it's available, people are actually more aware right now. Don't say myself. Anyway, people are actually more aware. But it's good, like what you said,
But nowadays our salads outside there are quite expensive. Like, I mean, if you have the spending power and the ability to actually order, then that's good. Otherwise, if you are at home, usually on the weekends, I tell people if you are on the weekend at home, you can actually prepare some salad, keep it in the fridge. Yeah, and then when you come back home after work, you can have some salad in your diet. That's one way to incorporate vegetables. Yeah.
Okay.
Because usually outside, if you order vegetable, you tend to see they are quite oily.
Okay.
Those cooked one, oily, salty, and usually the color, usually be bright green, then become a very dull green. It's overcooked really.
Okay.
Yeah.
Alright. Good.
Yeah.
Okay lah. So basically,
That's about the pigmentation and the diet. Yeah. But otherwise, is there any questions from the audience? Whether per se into pigmentations, especially the ladies, is something that we always want to know. Angel. My favorite doctor.
Thank you.
What about William? It's not your favorite. He's stuck there like, how?
Okay lah. So remember, so take home message. Skin pigmentation basically usually due to sun damage. So apply your sunblock, especially if you are female lah. I know males really don't apply, so I won't force you. Okay. Then
even indoor office also have to apply sunblock.
For female. Yeah, because indoor light, ultraviolet light, they do damage our skin. Book wise. Okay. Then of course, treatment wise, if you are having issue itself, go to your doctor itself, seek for advice. Yeah. Then prevention, say earlier, how to clean your face, simple. And diet wise, although like she said now, nutritionist says, if it's not 100% proven, right? But then it's no harm lah, eating healthy. Yeah. Alright. So I think that's it lah. 很多病要看了。
很多病人要看了。can, no problem. If you have any questions, you all can always put it in our comment section. And Dr. Henry will just answer you when he's free.
Not me lah.
Our team.
Our team.
They're looking for you to answer.
Our team will answer it lah.
But otherwise, do like, comment and share our video. We'll load this up on our YouTube channel, Orchid Family Polyclinic. And if you have any other topic that you want us to discuss on our Facebook Live, do let us know on our Facebook page. We always welcome any topics and we try our best to answer them if we can, right?
Yep. Right.
Yes. Yeah,
Okay.
so you're also favorite. You doctors are awesome. Yeah, they know they're awesome. What about me? Yeah, I will chase after you later.
She's awesome too. She's very good.
So thank you for joining us today.
Yep.
Hope to see you guys next week. See
Okay,
you.
bye-bye.
Bye.
Okay, how to off this?